The newest reported case of Ebola in the U.S. is raising questions and fears about the odds of it spreading even further. WIAT 42 News reporter Mike McClanahan joins us live from a local walk-in urgent care clinic with more on what doctors are predicting here. Mike?
Much like hospital emergency rooms, walk-in clinics like these may be among the first places to see cases of Ebola because patients may walk in mistaking the early symptoms of that disease for any number of common illnesses. And even though there have been no known cases of Ebola in Alabama, local doctors are coming up with a new action plan just in case that happens. Dr. Amy Bentley says Americans shouldn't panic about the first reported cases of Ebola in the U.S., but she says it's not safe or smart to assume they will be the last. That's because infected people can walk around without knowing it for up to 21 days. Then the disease can
explode. I mean, this is the kind of disease that will explode. And just like, you saw in West Africa, it doesn't take very many infected individuals to have thousands of infected individuals. The person who was quarantined, who decided to go out for Chinese food. I mean, people just make decisions that aren't necessarily good ones.
Doctors say early intervention is vital, and that's complicated because the symptoms of Ebola are much like those of the flu. Doctors say early intervention is vital, and that's complicated because the early symptoms of Ebola are much like those of the flu. Fever, body aches, nausea, GI issues, and possibly a sore throat could all be early warning signs of Ebola. The flu season has already begun, so Dr. Jordan Vaughn says it's important that doctors ask patients with the symptoms if they've been in contact with anyone with Ebola or if they've been to an area where the disease is endemic.
Those are going to be the big things right now. Now those questions might broaden as we have more of, of an outbreak, but for the most part, those two things right now can basically narrow everyone into a very, very small subset of people.
Now, the CDC has asked hospitals to isolate Ebola patients, and Dr. Vaughn says UAB Hospital has a few isolation rooms, but he thinks the CDC wants all of the Ebola patients treated at specific facilities designed for that purpose, like Emory in Atlanta, which happens to be right near the CDC headquarters. Live in Birmingham, Mike McClanahan, WIAT 42 News. Coverage you can count on.